Right. First port of call for our treatment is going to be the scalenes muscles. As we know, when I assessed him, it's really, really tight on that side. We know that first rib is quite high. So to soften off that first rib, try and bring it back down a little bit, we're going to do some work into the scaleni. So we've got anterior, medius, and posterior. Okay. That's your SCM muscle. Anterior is going to be underneath here. Medius is going to be right there, and posterior will be at the back. So because Jolie's not had any work on this muscle before, we're going to be nice and gentle and broad. Okay, so we get a bit of cream on there. I'm using the Premax Arnica. So it gives me a nice, good little bit of slip. So I'm just going to get him used to the pressure and where I'm working. Okay, so hand's going to go underneath back of his head, sort of around his suboccipital area, so that gives me the access to move the head. Okay, so what I'm going to do is I'm going to work the muscle down and I'm going to shorten it off as I work. Okay, because I want it to soften off, as opposed to working the muscle and then lengthening it. Okay, so it's obviously for someone who's not had work in this area before, that is the preferred option. Okay, so I'm just going to push the SCM up and out of the way. Okay, sink in, and then I'm just going to slowly go into rotation and just work all the way down to that first rib. Okay, like so. Just working all the way down. Okay, so obviously if you're going in too deep, what will happen is they'll start to guard, so you don't want them to guard. So you just got to soften your pressure off. Different for everyone, this muscle. So really got to take your time and care, and don't try and rush through it either. Okay, couple more sweeps along here. Beautiful. Okay, now I can drop down and I can hit that medius, scaleni's medius. So I don't have to push SCM out of the way, it just drops straight in there. Same again, sink in, pressure down, and then all the way. Here you go on there, Jolly, all right?
Yep.
Yep, okay. I'll know because he'll guard against me. All right, so and I don't want that. A couple of more sweeps through there. Okay. God, you're tight. Okay, and then I'm going to drop back here. I'm going to hit that posterior. Okay, the posterior attaches onto the second rib. Okay, so the referral for this will be a bit different to the anterior and the medius. All right, beautiful. Sweet. Simple. That's all we need to spend in there. Going to leave that for scalenis, and we'll come back and we'll do his first rib.